I want you to do something right now. Look down at your legs. Go ahead. I'll wait, because what I'm about to show you in the next few minutes could change or save your life. Supplement. There are 7 warning signs that appear on your legs before a heart attack, before a stroke, before a blood clot reaches your lungs. 7 signs that your body has been broadcasting, sometimes for years, that the blood flowing through your arteries and veins is in serious, serious trouble. Supplement, and most people, most of my own patients, walk right past these signs every single day without knowing what they mean. I've seen this mistake destroy lives. I've watched patients lose limbs. I've delivered news to families that I wish I never had to deliver, all because the warning was there, written plainly on the skin and tissue of their legs, and nobody knew how to read it. Today, I am going to teach you how to read it. My name is Dr. Mandell, and after more than 40 years of clinical practice in preventive medicine and chronic disease management, I can tell you with absolute certainty, the legs are one of the most revealing windows into the health of your entire cardiovascular system. Think about it this way. Your heart is the pump. Your arteries are the pipes carrying oxygen-rich blood out to every corner of your body. Your veins are the return lines, bringing that blood back. And the legs, the longest, most gravity-challenged stretch of that entire system, are the first place problems show up, the first place the system starts to fail. There is a condition called peripheral artery disease, PAD, that affects over 8 million Americans, the majority of them over the age of 50. There is chronic venous insufficiency, CVI, affecting an estimated 30% of the adult population. There are blood clots, nerve damage from vascular compromise, and the early stages of heart failure, all of which whisper their warnings through the skin, the hair, the temperature, and the shape of your lower legs and feet. And here is what keeps me up at night as a physician. The American Heart Association estimates that up to half of people with significant peripheral artery disease have no pain whatsoever. No pain. Silent damage, building, narrowing, hardening, until one day it isn't silent anymore. So today I am walking you through 7 signs, 7 specific things you can see and feel on your own legs that tell you your circulation is in trouble. Some of these will surprise you. Some of them may make you uncomfortable. Good. That discomfort might just push you to pick up the phone and call your doctor. Let's begin. Sign 1. Your leg hair is disappearing. I want you to look at your lower legs and feet right now, particularly your shins, your ankles, and the tops of your feet. And I want you to ask yourself, where did the hair go? This is one of the most overlooked signs of circulatory failure that I see in clinical practice. Semen. When the arteries supplying blood to your legs become narrowed or partially blocked, the tissues in your lower extremities stop receiving adequate oxygen and nutrients. And one of the first things that suffers long before you feel pain is hair growth. The tiny hair follicles in your lower legs and feet require a constant supply of nutrient-rich blood to function. So when that supply gets choked off, the follicles die back. The hair thins, becomes patchy, and eventually stops growing altogether. I had a patient, I'll call him Frank, a 63-year-old retired plumber who came in for a routine physical. His wife had pushed him to come. He hadn't seen a doctor in 6 years. When I examined his legs, the lower third of both shins were almost completely hairless, smooth as glass. He hadn't even noticed. He said he figured it was just getting older. It was not just getting older. His ankle brachial index, A simple test comparing blood pressure in the ankle to blood pressure in the arm revealed significant arterial blockage in both legs. She had peripheral artery disease that had been silently progressing for years. We caught it. We treated it. He kept both his legs. But if he had waited another 2 or 3 years, the story might have ended very differently. What most people do wrong is exactly what Frank did. They assume hair loss on the legs is cosmetic, trivial, or just a normal part of aging. It is not automatically normal, especially if it's appearing on the lower legs and feet specifically and is combined with any of the other signs I'll describe today. What should you do? Let's look at your lower legs right now. Compare the hair density between your upper and lower leg. Supplement if your lower leg and foot are significantly less hairy than your upper leg, especially if this is a recent change. Bring it to your doctor's attention and ask about a vascular assessment. Sign NS2, skin color changes. Pale, blue, or deep red the color of your legs is your circulatory system speaking to you in the clearest language it has. Healthy legs with good blood flow have a consistent warm skin tone. They may vary slightly based on your natural complexion, but the color is even and matches the rest of your body. When circulation starts to fail, that color picture changes, and the changes are very specific. If you raise your legs above heart level, say lying on your back and lifting them up, and they become very pale or almost white within about 60 seconds, that is a serious warning sign. Supplement. That pallor tells you the arteries are so narrowed they cannot maintain adequate blood pressure against even the mild challenge of gravity. Now put those same legs back down, dangling over the edge of a bed. If the color that comes back is not a healthy pink, but instead a dark, dusky red or purple, what cardiologists and vascular surgeons call dependent rubor, you are looking at severely compromised circulation. That dark red flush is the blood pool struggling to perfuse tissue that has been oxygen-starved. A patient I'll call Dolores, a 71-year-old woman with type 2 diabetes, came to me after noticing that one of her feet had turned a strange bluish-purple color at the toes. She thought she had bruised herself. She couldn't remember doing it, but she assumed that's what it was. It wasn't a bruise. It was ischemia, inadequate blood flow to the tissue. Its toe was beginning to die from the inside. We referred her immediately to a vascular surgeon. She required a procedure to open a blocked artery and restore blood flow. She kept her foot, supplement, but I will never forget the look on her face when I explained what could have happened if she had waited another few weeks. What people do wrong is they attribute color changes in their feet and toes to cold weather, tight shoes, or sitting too long. And sometimes that's all it is. But if the color change is persistent, affects only part of the foot, or is accompanied by any other sign on this list, it is an emergency situation that requires immediate medical evaluation. This is not a wait and see. This is a call today. Sign 3, swelling that doesn't go away. Most people have had swollen ankles at some point. After a long flight, after a hot day, after standing for hours at a family event. That kind of transient positional swelling, pitting edema that resolves after a night of sleep with your feet elevated is generally not dangerous on its own. But I'm not talking about that. I'm talking about swelling that is persistent. Swelling that is there every morning when you wake up. Swelling that has gotten progressively worse over weeks or months. Swelling that, if you press your thumb firmly into the skin of your ankle and hold for a few seconds, leaves a little pit, an indentation that takes time to spring back. That is your body screaming at you. Persistent pitting edema in the legs can signal several serious and potentially life-threatening conditions. It can indicate that the heart is not pumping efficiently, what we call congestive heart failure, and fluid is backing up into the lower extremities because the system can't keep up with circulation demand. It can indicate that the valves inside your leg veins have become incompetent and blood is pooling rather than returning properly to the heart. It can indicate kidney disease, liver disease, or severely low protein levels in the blood. And critically, sudden one-sided swelling in a calf or thigh can be a deep vein thrombosis, a blood clot that can break free and travel to your lungs in what is called a pulmonary embolism, a potentially fatal emergency. I remember a patient I'll call Gerald, a 68-year-old retired teacher who came to me after noticing his left calf had been swollen and slightly warm to the touch for about 10 days. He assumed he had pulled a muscle. He was taking ibuprofen and waiting it out. His wife finally insisted he come in. The ultrasound showed a large DVT, deep vein thrombosis, in his popliteal vein behind the knee. We admitted him that afternoon. He was put on blood thinners immediately. 2 days after his admission, a fellow patient on the same ward who had refused to come in sooner for similar symptoms suffered a massive pulmonary embolism. The contrast was not lost on Gerald or on me. If your legs are persistently swollen, especially if it's one-sided, warm, red, or tender, do not wait. This is not a home remedy situation. This is a same-day or emergency room situation. Please do not let pride or procrastination cost you your life. Sign ESH4, pain that comes when you walk and stops. There is a pattern of leg pain that is one of the most classic hallmarks of peripheral artery disease, and I have seen it missed by patients and occasionally by physicians who don't ask the right questions. It goes like this. You start walking. Maybe you walk half a block, maybe a few hundred feet, and a cramping, aching, or heavy pain begins, usually in the calf, sometimes in the thigh or buttock. You stop walking. Within 1 to 5 minutes, the pain completely disappears. You start walking again. The pain comes back. This pattern has a medical name, intermittent claudication, and it is caused by one thing. Your leg muscles are demanding more blood and oxygen than your narrowed arteries can deliver during activity. When you rest, the demand drops, the available supply is enough, and the pain resolves. That relief is not reassurance. That relief is just a pause in the crisis. I had a patient, I'll call him Victor, a 66-year-old who had been an avid golfer his entire life. He told me he had given up golf because of bad legs. He described stopping every few holes to rest because of calf pain. He had told himself it was just his age catching up with him. He had told himself this for almost 2 years. When I finally got his full vascular workup done, his right femoral artery, the major artery running down the thigh, was over 70% blocked. His left was not far behind. He was a significant heart attack and stroke risk, because the same process that was blocking his leg arteries, atherosclerosis, the hardening and narrowing of arteries by plaque, was almost certainly happening in his coronary arteries and carotid arteries as well. That is the thing most people do not understand. CAD is not just a leg problem. It is a systemic cardiovascular disease marker. People with peripheral artery disease have a dramatically elevated risk of heart attack and stroke. So the leg pain is the messenger. The message is about your whole cardiovascular system. If you recognize this pattern, pain with walking, relief with rest, please stop dismissing it as getting old. Just make an appointment. Tell your doctor exactly what I just described. Ask about an ankle brachial index test and a cardiovascular risk assessment. This one conversation could save your life. Sign 5, wounds or sores on your legs and feet. That won't heal this one is the sign that leads to amputations. And I have to be that direct with you because I have watched it happen, and it is one of the most devastating things I have ever had to help a patient and their family through. When circulation to the legs is severely compromised, particularly in people with diabetes, but not only in people with diabetes, even the smallest wound can become catastrophic. A blister from a tight shoe, a small cut from a toenail clipped too short, a minor scrape. Under normal circumstances, your immune system rushes blood to the area, delivers healing nutrients and white blood cells, and the wound closes in days. But when the arteries are so narrow that adequate blood cannot reach the tissue, that repair mechanism fails completely. The wound stays open. Days become weeks. Weeks become months. The tissue around the wound begins to die. Infection sets in. An infection in oxygen-deprived tissue spreads fast and deep in ways that are very, very difficult to control. I cannot count the number of times over my career that I have seen a patient arrive with a wound on their foot that their family physician had been treating topically for months with antibiotic cream and dressings. Not because the physician was negligent, but because the underlying circulatory crisis had never been identified. The wound isn't the problem. The dead pipeline underneath it is the problem. If you are over 60, especially if you have diabetes, high blood pressure, or a history of smoking, examine your feet every single day. Every single day. The bottom of your feet, between your toes, around your heels. If you cannot see the bottom of your feet clearly, use a mirror or ask a family member to help. Any sore, any wound, any area of skin breakdown that has not healed within 2 weeks needs urgent medical evaluation, not next month, not when it gets worse. Now, sign 6, your legs feel cold. Especially one more than the other. Run your hand along your lower leg right now. Then run your hand along the upper leg. Are they roughly the same temperature? Now compare both legs to each other, right versus left. A persistent, noticeable temperature difference between your 2 legs, where one is significantly colder than the other, is a circulatory red flag that I take very seriously. And I mean the kind of cold that is there consistently, not just after you've been sitting in a cold room. Chronically cold lower leg or foot is telling you that the blood delivering warmth to that tissue is simply not getting through adequately. It's like having a blocked pipe in your home's heating system. One radiator stays cold while the rest are warm. The cold is telling you exactly where the blockage is. I had a patient, I'll call her Patricia, a 69-year-old who always wore thick socks and extra blankets over her legs even in warm weather. Her family had joked about it for years. She'd been cold-natured her whole life, she said. When she came in for a routine visit, I asked her to pull up her pant legs. Her left leg from the knee down had a noticeably different pallor and was measurably colder to the touch than her right. She had significant iliac artery disease, a blockage in the large artery in her pelvis feeding the left leg. She thought she was just cold-natured. She had, in fact, been living with compromised circulation for years. The important distinction here is asymmetry, one side colder than the other, and persistence. Both legs being a bit cool is less alarming. One leg or foot being consistently colder than the other is worth investigating. Check it regularly. Know you're normal, and if something has changed, talk to your doctor. Sign 7, varicose veins combined. With skin changes, let me be clear about something right away. Simple varicose veins, those ropey, raised, bluish veins on the surface of the legs, are extremely common, affect roughly a third of adults, and in many cases are primarily a cosmetic concern. I do not want you to panic every time you see a varicose vein, but there is a category of venous disease beyond simple varicose veins that I want you to understand, because it represents a significant threat to tissue health and quality of life. Supplement, and most people don't recognize it until real damage has been done, when the valves inside the veins of your legs stop working properly. Supplement, blood that should be flowing upward toward the heart begins to pool and flow backward. This chronically elevated pressure in the veins of the lower leg causes a cascade of changes that appear directly on the skin. The skin around the inner ankle begins to change in very specific ways. It may develop a brownish or reddish discoloration caused by red blood cells leaking out of the overloaded veins and breaking down under the skin. The skin may become thickened, hard, and leathery, a condition called lipodermatosclerosis. Small clusters of tiny dark varicose veins may appear around the ankle, fanning out from a central point like a starburst. These are called corona phlebectatica, and they are one of the most reliable signs of advanced chronic venous insufficiency. And at the most serious end of this spectrum, venous stasis ulcers. Open wounds, typically on the inner ankle, that develop in chronically congested venous tissue. Supplement. These are notoriously difficult to heal and represent a significant quality of life crisis for those affected. A patient I'll call Dorothy, a 73-year-old who had had varicose veins since her 40s, came to me when she noticed the skin around her left ankle had turned a dark brownish color and felt hard and slightly tender to the touch. She thought it was a bruise from bumping the furniture, but there was no injury. What I saw was classic advanced chronic venous insufficiency with early lipodermatosclerosis, the stage just before venous ulcers begin to form. We intervened early with compression therapy, a referral to a vascular specialist, and specific exercise and elevation protocols. The skin changes stabilized. No ulcer developed. But had she waited 6 more months, supplement, I am not confident the story would have ended there. If your varicose veins are accompanied by skin color changes, hardening of the skin around the ankle, persistent itching, or any open area, please understand that you are past the cosmetic stage and into the medical stage. This needs professional evaluation. I want to stop here for just a moment. Supplement, because I've been talking to you as a physician with facts and cases and mechanisms. Supplement. But I also want to talk to you as a human being who has spent a lifetime watching what happens when people ignore the warnings their bodies are sending. I have seen strong men who survived hard lives, raised families, built things with their own hands, reduced to wheelchairs because of a leg that didn't have to be lost. Supplement, I have seen grandmothers who were the heart of their entire family spend their final years unable to walk to the mailbox, not because of cancer, not because of some unavoidable fate, but because of a circulatory problem that had been waving its red flags for years, and no one knew how to see them. Your legs carry you through your life. Supplement. They carry you to your grandchildren's birthday parties. They carry you through your garden. They carry you up the stairs to your own bedroom. When your legs fail, and I mean truly fail, when the circulation collapses completely, it is not just a medical event. It is a loss of independence, of dignity, of the simple freedom of movement that most of us take completely for granted. You deserve to keep that freedom. Your family needs you to keep it, and you cannot protect what you don't know you're losing. Let me give you all 7 signs one final time so you can check yourself today. Number 1, leg hair loss, especially on the lower leg and foot. Number 2, persistent skin color changes, pale, bluish, or dark red. Number 3, swelling that doesn't resolve, especially if one-sided. Number 4, pain when you walk that disappears with rest. Number 5, wounds or sores that are not healing. Number 6, one leg or foot consistently colder than the other. Number 7, varicose veins combined with skin darkening, hardening, or breakdown around the ankle. If you have one of these signs, pay attention. If you have 2 or more, do not wait. Schedule an appointment with your doctor this week. Show them this list. Ask for a vascular assessment. That conversation could be the most important one you have this year. Now, if this video helped you see something you hadn't noticed before, if something I said today made you look at your legs differently, I need you to do 3 things right now. First, hit that like button. It lets me know that this kind of real, honest, doctor-driven health information is reaching the people who need it. Second, subscribe to Longevity Lane and hit the notification bell. Every week I bring you the health truths that most people only discover when it's already too late. You deserve to know this now, so while you can still do something about it. Third, share this video. Send it to a parent, a spouse, a sibling, a friend, anyone over 50 who you care about, because the signs I described today are sitting on someone's legs right now, unrecognized, unaddressed, ticking like a clock. You sharing this video might be the reason they catch it in time. Leave me a comment below and tell me, did any of these 7 signs surprise you? Have you noticed any of them on your own legs or on a loved one's? I read every comment, and your story matters. Your health depends on this information. Please don't keep it to yourself. Your legs have been trying to talk to you. They have been leaving messages in your skin, your hair, your temperature, your pain, quietly, patiently, waiting for you to listen. Today, I hope you heard them. The signs of circulatory failure are not invisible. They are not mysterious. They are written plainly on the surface of your body for anyone who knows where to look. And now you know where to look. Do not waste that knowledge. Check your legs. Check the legs of the people you love. And if something looks wrong, act on it. Quickly, boldly, without shame and without delay. Because there are 2 kinds of patients I have known in my 40 years of practice. Those who listen to their bodies early and those who wish they had. Don't be the second kind. This is Dr. Mandell. Take care of your legs. They are carrying you through this life. Make sure they can keep going. I'll see you in the next video. If you care about your health, want to understand what's silently harming your body, and are ready to learn the truth about living a longer, stronger, and healthier life, subscribe to Longevity Lane with Dr. Mandell. Here we reveal the health truths most people discover only when it's already too late.